Welcome back to the program. It's now 9:14. According to the American Academy of Pediatrics, almost 7.4 million children have tested positive for COVID-19 since the onset of the pandemic. Now add to that flu season, and it is tough as a parent to know what to do. This morning, we welcome back to the program and actually back to the building, Dr. Scott Cyrus, pediatrician. Welcome.
Thank you.
It's great to see you.
Yes, once again.
We have missed you, but we have had to deal with a lot.
We all have.
So let's talk a little bit about, now that we're kind of hitting this flu season, who's at most at risk when it comes to our little ones?
Well, you know, when it comes to the little ones, you think about the ones that have a problem with vaccinations. Of course, under 5 years of age, under 6 months of age, even under 6 months of age, we can't give a flu shot to them. We can't give a COVID vaccine to them. But under the age of 5, and I guess, again, like I said, especially under the age of 2 to 6 months, really a difficult problem to really want to put a bubble over them.
Right, and just protect them at all costs.
Exactly.
So let's talk a little bit about symptoms, because I know early on people can get very confused about COVID symptoms. Add to that the flu. How similar are they?
Well, they're really actually fairly similar. I mean, you get fever with flu, you get fever with COVID. You get a runny nose, you get a cough. So many times you get the high fevers with both. And so it's really hard to discern exactly what your child may have. And so obviously, protecting them is a huge thing, and the vaccine is a part of that protection.
Is it possible to have the flu and COVID at the same time?
It is, because what happens is that your immune system gets hit by one or the other, and again, if you get exposed to it, then you're very likely to have the flu. The problem with the children is they can actually have the flu or COVID, spreading it around their family, their school, their daycare, and not really show symptoms of it. And then they show symptoms of it, and then you have this whole
You've already exposed
area
everybody
of exposure.
Yeah. Let's talk about what are you hearing from parents when they say, I can only imagine it's been tested, but has it been tested? Is it dangerous? Is it going to be okay? What are parents asking you?
Of course, they worry about the technology.
Right.
They worry about the mRNA technology, and it's been around for 20 years.
Okay.
I mean, we know this, and people, there are those that are out there that are saying it can cause problems with pregnancy, or it can cause, infertility, and there is no data. I mean, as a pediatrician that has been doing this for over 25 years, our vaccines are studied daily, and they're looked at daily, and these are safe vaccines. I recommend them obviously for my own family, for my patients, to make sure that they are protected as well as possible.
I put this together. You gave me some information. I'm calling it kind of like flu facts. So that way, if people can kind of understand about getting the flu shot. So last year, 7.5 million cases were prevented because of vaccines? Because
of the flu vaccine. It was predicted from the CDC that many disease would happen, that much of the disease population would have happened without the vaccine.
Wow. And then the distribution of the vaccine itself.
We have plenty of vaccine. We have 170 million doses of flu shots out there that have been distributed, and so we're not running into some years we run into shortages.
Right.
This year is not going to be the case. We have plenty of vaccine from plenty of makers.
And then if a parent wants to go ahead and get both of them at the same time, that's okay?
Not a problem. They could. It's really interesting. We complain about side effects from the vaccine, and we complain about, but we see that really in the adult population, our kids are having very little side effects. They have zero side effects really from the flu injection, other than it's an injection.
Right.
They're all allergic to the injection.
Yes,
but,
we are.
But same thing with COVID. It's having very, very little side effects. Maybe a little tiredness, sore arm, but other than that, they are tolerating it very well.
Good. And then the overall message today about prevention.
It's a combination. It's not one thing. People tell me, I'm fully vaccinated, but yet I still got COVID. It is not just one thing. It is really and truly wear a mask, wash your hands, cover that cough, and get vaccinated. It is a combination of those things. And if you know somebody that's sick, say hi from a distance.
Sure.
Keep your distance from them and play it smart. Don't let your guard down. This Omicron variant, Delta, it just keeps changing. And so don't let your guard down.
I want to ask you one more quick thing before we go. So I know, holidays can be stressful anyway. When somebody in your family, though, says, I'm not coming because you are vaccinated, you aren't vaccinated, I mean, it can be a situation of life and death.
It can be. It can be. You know, when you tell me that 98% of the people in the hospital right now are not vaccinated, that, you know, the vast majority are on ventilators and in the ICU are not vaccinated, you can't tell me this is not working. It's keeping us healthy, and it is the combination of wearing a mask and all of those things and getting vaccinated that really, really puts happy holidays, you know,
in perspective.
In perspective, exactly right.
All right. Thank you so much.
You're
Great
welcome.
to see you. Come back in next month if you can. All righty.